In 1918, the world was still at war. The movement and mobilization of troops placed large numbers of people in close quarters, with overcrowding and unhygienic conditions. The health services at that time was very limited, and a lot of healthcare workers were deployed in World War I. No coordinated plans existed for national, state, or local pandemic planning. Only some cities were able to implement community measures, like banning public gatherings, issuing quarantine or isolation orders, and closing schools, as the federal government had no role to help coordinate these interventions. Antibiotics had not been developed yet, and flu vaccines did not exist in 1918. Penicillin was discovered later in 1928. Mechanical ventilation and intensive care support was not available. Hospitals didn't have many options other than supportive care. The decision to reconstruct the deadliest pandemic flu virus of the 20th century was made with extreme caution and safety. The CDC determined that only one person would be granted permission, lab access, and the massive responsibility of reconstructing the Spanish flu. Dr. Terence Tumpey was approved for the project. If he became infected, he was informed that he would be placed in quarantine and denied contact with the outside world. In August 2005, lab studies on the 1918 virus began. Mice were infected with the virus. Measures of morbidity were collected and documented, like weight loss, virus replication, and 50% lethal dose titers. Using reverse genetics for comparison, varying combinations of genes from the 1918 virus and contemporary H1N1 flu viruses were created as well. The 1918 virus was at least 100 times more lethal than one of the other recombinant viruses tested. A well-documented effect of the 1918 virus was severe and rapid lung damage. The victims of the Spanish flu experienced fluid-filled lungs, as well as severe pneumonia and lung tissue inflammation. The constellation of all 8 genes together made an exceptionally deadly virus. Since 1918, the world has experienced 4 additional pandemics. In 1957, 1968, 2009, and most recently, 2020. These subsequent pandemics were less severe and caused much lower death rates than the 1918 pandemic. The 1957 H2N2 pandemic and the 1968 H3N2 pandemic each resulted in an estimated 1 million global deaths, while the 2009 H1N1 pandemic resulted in fewer than 0.3 million deaths in its first year. The 2020 COVID-19 pandemic resulted in over 3 million deaths and still counting. It is not over yet.
A virus is basically an infectious agent. What that means is that it can infect people. And viruses are actually one of the simplest infectious agents. So it's basically the genetic material and a protein shell around it. So genetic material is basically codes for proteins, and it's a blueprint for an organism. And then the shell around it is mostly for protection. So the one key thing about viruses is that they cannot live and survive on their own. They need to infect other cells, so typically human cells or other animal cells, in order to actually grow and survive. It's believed that most viruses are originally coming from an animal source, and they, over time, they evolve and they adapt to infect humans, and then to also transmit from humans to humans. In terms of for our day-to-day living, as to where viruses come from, that really depends on the virus we're talking about. So respiratory viruses typically come through droplets. So meaning like when we cough or sneeze, droplets leave our respiratory tract, and if they land on another person, that's how can be transmitted through other routes, like sexually transmitted infections, through needles, through contaminated needles. So it really depends on what kind of virus we're talking about as to how they transmit. So in contrast, a bacteria is a free-living organism, meaning that it has everything it needs in order to survive and to grow. And bacteria are much larger. They're about 100 times bigger than viruses. You can see a bacteria with a light microscope, but you cannot see a virus. The viruses are too small to be seen under a light microscope. The number of viruses that can affect humans, that can infect humans, are probably hundreds. Some are fairly benign. They may cause something minor, like a common cold. Others are more serious, like for example HIV or hepatitis. And in terms of how much immunity we have, that really depends on how much exposure we've had as a population to a specific virus. So to give you an example. For example, let's say, a really good example is measles, for example. So we have a really good vaccine against measles. So everybody who's vaccinated against measles has nearly 100% protection against measles. Whereas if it's a brand new virus like COVID-19, the immunity levels are expected to be low because we haven't seen that particular virus before. So it really depends on the particular virus or the bacteria that we're talking about. There are some organisms that are very specific to a specific organ. So, a good example is the hepatitis viruses. They specifically affect the liver. There are other viruses that cause more than one type of illness. So a good example is COVID. Actually, COVID is primarily causes respiratory illness, but it can also cause GI illness, so diarrhea and vomiting, especially in kids. And then there are other bugs that can basically cause much more severe disease. So they can basically spread throughout the body and cause systemic illness. There's no particular difference between viruses and bacteria in terms of how they affect. Both viruses and bacteria can cause very similar or very different effect on the body. So a really good example is actually sore throat. So most sore throat is caused by viruses, right? But in a small minority of cases, it can be caused by a bacteria called strep, which is why we call it strep throat. DNA, the full form is deoxyribonucleic acid, and the RNA, the full form is ribonucleic acid. They're both genetic codes, basically genetic material. The way I think of them is like they're two different languages basically, but they have very similar function in that they code for proteins. In humans, our genetic material is in the form of DNA, but from that DNA, RNA is made, and then from the RNA, the protein is made. Some viruses just have RNA, and from RNA you can make straight protein. So whether some viruses will have DNA as their genetic material, and some viruses will have RNA as their genetic material. There's a few different ways that gene study really helps advance the science of medicine. One common way is that genes, like I was mentioning, it codes for proteins, and proteins can be targets for vaccines. So they can help us with vaccine development. That's one potential use. The other common use that has been used for genetic study is choosing medications, so antibiotics and antivirals for treatment of certain infections. So, for example, hepatitis C. If you have a certain genotype, then we have a really good antiviral medication against it. In the same vein, if a virus is changing over time, it may become resistant to that particular drug or that vaccine. So it helps us monitor that and potentially help develop new targets for vaccine and for development. A third way that the genomic study has been very helpful is that something that we're doing here at BCCDC is trying to understand how disease is spreading in a given community. So what we do is we sequence the entire genome and see what mutations might be happening. And based on that, we can track how the disease may have spread in a given community or in the province. So that is a more of an upcoming and emerging application of genetic studies. But this is a fairly new but a very exciting area of scientific advancement. Yeah, viruses are very smart. They're changing. They're smarter than us. So when we talk about mutations, we're talking about changing the genome of the virus. So it can happen in a number of different ways. The most common way is what we call, and this is what mutation really means, is changing the code. So viruses and bacteria, they replicate, they change, they're growing, and that replication, part of that replication is to photocopy the DNA. But that photocopying process is imperfect, so it basically causes errors, and those errors is what causes mutations. So if you think about it, if you have a gene, it changes, so you change the protein, and so it changes the function of that cell. So when that happens, we basically get new proteins, and so that may mean that the virus has a new function. Perhaps it has a new resistance factor, or it has changed in some other ways that is causing more problems, or sometimes less problems as well. Another way a virus can change is basically by acquiring DNA or RNA or genetic material from another virus. So this is kind of like a mixing and matching of genes that happens. That's another way of how viruses can sometimes change as well. Some viruses change a lot more than others. A really good example is influenza. Influenza, we know that it changes every year, which is why we have a vaccine for it every year. And then there are other viruses, like for example measles, that haven't changed much over the course of the last few decades, and it's more or less the same virus that's circulating. The COVID-19 virus hasn't changed much thus far. Recognizing that we only, this is a fairly new virus, so there's lots that we are still learning about it. It hasn't seemed to change a lot. That's not to say that it cannot change. It can, but that's part of why we are doing. Part of the work that we're doing is monitoring how the virus is changing by looking at the genetic sequence of many of the viruses that we see in the province. There's a story behind why it's called the Spanish flu, but let's come back to that in a second. So there were a few things. So one, it was a new virus, meaning that the population did not have much immunity to it. So everybody was susceptible. That was one reason of why the pandemic of 1918 was severe. The other factor was the virus itself and the effect it had on the humans. So it just caused very severe illness in many of the people who were infected. That's another reason. And third reason is that it was in the background or the context of World War I. So if you can imagine that there's a world war going on, a lot of the effort and resources are being spent on the war effort rather than the pandemic that was happening. So those are probably the three reasons why it was quite serious. It's estimated that about 20 to 50 million people had died of the pandemic at that time, and thankfully something of that nature has not occurred again. So when we say dangerous, it can imply a few different things. So the one thing that of course is concerning is that it's a completely new virus. So meaning that we've had very little exposure and hence very little immunity to this pre-existing immunity to this virus. So that's why we really have to work to ensure that we keep the transmission to an absolute minimum and eliminate it if we can. But elimination is not a realistic goal. That's why we want to minimize the transmission that happens. But at the same time, we want to keep things in context in that, vast majority of people who will get this virus will either have absolutely no symptoms, what we call asymptomatic infection, or will have very mild symptoms, so it'll feel like a common cold. The rest of the people will have more severe illness, so it's estimated maybe perhaps 10% of people will get sick enough that they will require hospitalization, and a small percentage would be expected to die. So that number is still higher than what you would expect out of most respiratory virus, and I think that's what most people get concerned about. But recognizing that for a vast majority of people, it's not a dangerous virus. Nonetheless, we need to make sure that we are taking all the steps necessary to prevent that transmission in our community, so that we keep that number extremely low, and we prevent our healthcare system from imploding. Both are caused by viruses, respiratory viruses, that is, but they're from different families. I think there's a few ways that the situation is different. One is that I think we have a lot more information and a lot more knowledge about how viruses behave and how we can prevent the effects of these pandemics. A lot of the information that you've heard over the last several months about how to protect yourself, that probably wasn't so easily available 100 years ago. So that's one thing, and then the other big thing is that we don't have a world war happening in the background. So, we were able to gather all the resources and all the attention that this pandemic really needs in order to bring it under control. So those are probably some of the big reasons why, or why we expect that this COVID-19 pandemic would not be as devastating as the Spanish flu. We have a lot of antiviral medications available now. So, you might have heard of antiviral medications for infections like HIV, hepatitis C, the herpes virus. There's an antiviral medication for it as well, and then of course there's antiviral medication for influenza as well. There's no approved antiviral medication for COVID-19 right now, but as you can imagine, that there's a lot of research and a lot of effort underway to find one, to develop one, along with the vaccine research that is happening. So I expect that we probably will have something, but it's tough to predict the future with certainty. So my hope is that we'll have something in the near future. It's actually very similar to the messaging that we provide for influenza every year. So the number one way to prevent transmission of respiratory viruses in general, which includes COVID-19, is to stay home if you are sick. And so if you think about how viruses transmit, it transmits from one person to another, meaning you need a sick person that infects a healthy person. So if the sick person is isolated, meaning that they're not around other people too much, then they cannot transmit that infection. So that's the number one thing, is to stay home when you are sick. The second most helpful action would be to wash your hands frequently. And the reason we say that is because our hands are in many different places throughout the day, so they can pick up a number of different viruses. And a lot of people touch their faces throughout the day a lot, so it can bring those viruses closer to our respiratory tract and make us sick that way. So washing those hands frequently really helps bring down the bring down the possibility of an infection. The third thing, which is relatively new with the COVID-19 pandemic, is physical distancing. So it's a similar idea that, you know, if you're not nearby another person, then that also reduces the risk of transmission. Now we recognize, and I do recognize, that physical distancing is not always easy and it's not always practical. So so as long as people are staying home when they're sick and they're washing their hands, you know, there is some leeway around physical distancing, and we recognize that it's not always possible in every situation, but it's helpful to maintain as much physical distance as possible. Those would be the three big items that I would recommend for preventing transmission of COVID-19. So staying home when you're sick, washing your hands frequently, and maintain distance whenever possible. In our public health world, we call this surveillance. So what happens? So let's say if you get sick and you go to your doctor or your primary care provider and you get swabbed, that swab gets sent to a provincial lab where we test for different viruses. At the provincial lab or the provincial level, for example, here at the BC CDC, we put all that information together and we analyze that for the province, and that helps us understand what kind of viruses are circulating in the province. We give that information to the Public Health Agency of Canada, which does a similar analysis at the national level. And then PHAC will forward it on to the World Health Organization, which will do the similar analysis at a global level. So that's how public health surveillance works. And you know, with advancement in technology and advancement in microbiological techniques, we're always looking ways of getting more information, more useful information on how people can protect themselves at an individual level, and also how governments and policymakers can use that information to make policies that keep people healthy as much as possible. In terms of how people can help, especially in the context of this COVID-19 pandemic, we are really encouraging people to get tested if you are sick. By getting tested when you're sick, it really helps us understand where the virus is happening, and also if you don't have COVID-19, it also helps us understand that where COVID-19 perhaps is not circulating as well. So that would be my main ask or suggestion, is that if you are sick, make sure you get tested, and most importantly, make sure that you follow the advice of your local health officials, who will be aware of the best practices and also the circulation patterns in your community. I think the most, probably the one important message that I would like to convey is that there's a lot of information out there on the internet and you know, and social media, and it can be very confusing at times as to, you know, what is true and what is not. I would really encourage people to seek out credible sources of information. You know, that can sometimes be your healthcare provider, that can be the website of your provincial health authority, or your local health authority. So I would really encourage people to follow scientific evidence, scientifically backed and credible source of information.
So if we compare the 2020 conditions to the 1918 conditions, we can say we are far more educated with much better technology today. And while these aspects may be true, there is the fact that people had to deal with far more back then with a world war, a far more severe flu, and limited health care. We have none of that today. Were people mentally tougher back then compared to us today? And what can we do to be more prepared next time a 1918 type virus returns? Perhaps trust in our medical experts and try to stay united. It's probably our best chance for survival.